Hi everyone. For those who don't know, I'm Dr. Nishan Singh, one of the coordinators of TMCAA, Thrissur Medical College Alumni Association, CME for NEET PG Next. Today is a very special day. We have one of the All India toppers with us, none other than rank 31 INICET November 2023, Dr. Vandana G Krishnan, sitting next to me in the TMCAA hall at the TMCAA Academic Complex here in Thrissur Medical College. So this is a very interesting session for many reasons, and one of that, before we start the session, I'd like to say a very special thing about Dr. Vandana. So I was talking to her after the results were announced, and I was assuming she would be somewhere on a beach enjoying the rank and celebrating with her family or her friends. But to my amusement, she told me she is back at the hostel. So I was asking, hey, you could get all the any seat you want, but you're still back at the hostel. So she told me this interesting thing that my friends are not letting me go. And I'm back here to help my classmates at TMCAA study well and crack the NEET PG exam. So I was blown away with that answer from Vandana, because it shows how genuine as a person, as a medical student, as a future doctor she is going to be. And we are completely proud to have her as one of the TMCAA students for this year, CME 2023. So congratulations again, Vandana, and thank you for joining this interview, where we will have amazing takeaways, and all those takeaways I'm sure will be useful for multiple categories of NEET PG aspirants, including those who have started their preparation with XYZ resource, online or offline, and including those who have not started preparing at all and are looking at joining a program like TMCAA in the future. So with that introduction, let me welcome Dr. Vandana G Krishnan to this video interview. Congratulations and welcome to the session, Vandana. Let me ask you, where did you do your UG? And then can you please talk about your parents, your siblings also?
I am from Palakkad. My mom is a teacher and my dad is a retired state employee. My sister, she is currently doing her second year in IISER Pune. I did my UG in JIPMER, Pondicherry. So it's been a wonderful time there, spending 6 years.
Great. So let me ask you, Vandana, from JIPMER, which is one of the best institutes in the country, right? Why did you join TMCAA? Who introduced you to TMCAA? What was the reason to come here?
After the internship in JIPMER, I wanted to start fresh for my preparation, PG preparation, because I did not give much importance while I was working. So my seniors and my cousins told me about TMCAA. It was famous. There's a long history where many people used to come here and study and then get good ranks. And I thought it would be better for me to come to a place and stay there and study rather than studying at home by myself. So I didn't want to take a chance regarding my preparation. So I thought this would be the best for me to come here.
Great. That's great. So why I specifically asked this question is, see, there are countless interviews online regarding how to use an online resource, XYZ, many good resources out there. But I hardly see good interviews regarding a hybrid mode of preparation, where students use an online resource plus they opt for offline classes. So my next question is, what is that secret ingredient you think, when you combine the best of online with the offline program like TMCAA?
Because you get a routine here. By coming here, you are having a routine, like what to do, like you're having a schedule by itself. You don't have to put that much effort into making a schedule, or you don't have to put much effort to thinking like what should I focus, what should I not focus. You have all the resources online, like all the resources. You will have Q banks, you will have videos, you will have rapid revision, whatever it is, everything is available for us. But as we have access to many things, we don't know what to pick. We don't know, we are confused, almost we are confused to what to pick, what to do, what not to do. So I thought like if I need to focus on one thing, like I need to follow one source and one path. So after coming here, like I know for each subject what to do, like from where to learn things. So to know that, I was lost actually in many, like if you start seeing YouTube videos or like whatever things, then multiple people, there are many people will tell many things. Then you don't know what to follow. So here, after reading the TMCA CME vision of the CME program and how it is working, so then I understood that this suits me more. I can utilize my online resources. Along with it, I can come for this offline face-to-face class.
Yeah, amazing. Yeah.
Then I can make a mixture of it, like what is best for me. True. Individually, what is best.
True. Yeah. So to sum it up, like the best of both worlds, right?
Yeah.
And one very important point I understood from what you shared is there is a very defined schedule when it is offline,
yeah.
right? Because obviously when I talk to students, they have this problem. When you are online, there is plenty of options to get distracted, and you are like sometimes a frog in a well, right? You believe you are learning well, you are learning appropriate speed, but you know, when you are among your peers, that is where you have this realization where you really are, right? And the second point you said, it's very structured when it is a offline program. For example, here, if you look at biochemistry, Dr. Rebecca James ma'am completes the entire biochemistry in 3 days.
Yes, yeah.
Right? So you have to sit through that 3 days.
Yes.
Right? And by the end of that 3 days, the entire subject is complete.
Covered.
Similarly, anatomy, Ravidas sir completes in 3 days, and even the long subjects.
Long subjects.
So that is a huge advantage of having a hybrid model of learning. That's great. So let me ask you, Vandana, like, when did you start preparing for the NEET PG as well as INICET? Is it from your first year, second year or third year?
To be honest, for entrance I started preparing only after coming to TMCA, but I started using Marrow from third year. Before my, as there was COVID, for learning things I started using Marrow, and with that I used to do Q banks. Whichever modules I finished, I used to do Q banks. Doing Q banks was like a routine from third year, but I never considered like these many questions are coming from this subject, I should give more importance. Like focused preparation for INICET and NEET I started after coming to TMCA. Coming to TMCA.
Okay, great. So just to deep dive into your preparation, you said you started using a bit of Marrow, including videos, followed by solving questions, right from your third year. And how much were you able to complete, during till your internship before coming to TMCA?
In third year and final year, all the third year subjects I covered. All the final year subjects, including short subjects, except anesthesia, radiology. Then medicine, like whatever I could. Medicine I started from third year, but I could not complete medicine. Like medicine only, neurology and few systems I completed.
Let me deep dive into your journey there, Vandana. One category obviously would be students who have not prepared at all, right? Focused on the NEET PG or INICET, including internship maybe, right? And they come to TMCA fresh and start learning from here. That's category number one. Category number two are students like you who have covered some part of the syllabus for the entrance during their first year, second year, third year, or during the internship, and then join TMCA, right? So for these two category of students, which I believe will cover fairly the entire number of students who are aiming for NEET PG or INICET, what would be the ideal plan?
For the first category of students who haven't prepared anything, they can start fresh from here. We have a schedule for all the subjects till like with with adequate spacing between them. So we have to come and attend classes. Pre-test will be there, post-test will be there, and we'll follow in that schedule. We'll cover those subjects within that stipulated time. And in case if you are missing in any classes due to any reason, if it's good, I would say it's mandatory to have a backup source, because if you are sick or something, you're missing some classes, or if you cannot attend, so you have to cover that subject within that time to go with your friends, like to be in at par with the friends. And after that we have enough time for revision. Like if you're preparing, if this program is for March NEET PG, so like we have enough time for preparation also. If you don't have, if you haven't prepared anything, so just you have to come into this system and follow the system. That would be great. And for those who have already prepared, like some subjects they would have prepared, covered already. So I would suggest is that if you are confident in any of the subjects, you're confident, you have notes, you have done QBank, and here some different faculties coming by chance, then it would be better if you are confident, and if you feel, if you have done all the updates also. I would say it's not that you have watched a video in third year and you have left it there and you haven't done it again in this other, like some 3 years would have passed after internship. Not that, but if you have done it recently, all the updates have been covered, everything have been covered, and you have the notes, you have done the QBank, everything is there, then okay, you can sit back and revise that chapter on your own and do the QBank. Otherwise, if you're not confident enough, or if you don't have enough notes, you don't think that you can revise from that notes, or the same faculty is coming here, because it can happen. So if the same faculty is coming here, it's better you come here, it will be your revision. And I'll tell you, the online platform classes and the face-to-face classes are entirely different. So it's there are many points that will be covered in face-to-face classes than in online classes, because online classes are aimed for a vast population, including students who are doing professional exams, or those who are doing internship. They would watch it for gaining knowledge, but here our aim is to crack questions, so the approach is different. So I would say, like, but there will be very limited subjects, I'm sure, like in which you can sit and study by yourself. Others, you have to follow the system, you can follow the system.
Great. So yeah, that's a very interesting answer on how both category of students can use this hybrid model. So I think you raised a very important point there. If you are completely confident, self-motivated, that you can cover all these 19 subjects well sitting at home, that is also an option, right? And if there is, if you think there is an advantage when you come to a offline program, you are much more in sync, and also the faculty takes classes which is tailor-made just for cracking the entrance exam,
yes,
right?
Yes.
So is that a good way to sum it up? Any other point you would like to add?
I would say, like, it's my personal opinion. I wouldn't say if you should study 19 subjects on your own at home. I would say, because few subjects like pathology, pharmacology, microbiology, we covered pharmacology in 6 days. I would never be able to cover a subject as vast as pharmacology in as detailed as it is, and getting at the end of this class, I got a very good notes in which I will be referring it at least for another 5 years, because all the updates are there. In whatever things you want, it is there in that one note. You can make note like that for yourself, but it will take, I'm sure, like more than maybe 12 days, like double the time that I took here. So I wouldn't recommend studying all the 19 subjects by yourself at all. I meant, like, if in some short subjects, if you have done, you are confident, yeah, and then you can sit back. Otherwise, there are few subjects like pharm, path and all. I would recommend 100% you should come and attend a class.
Great, Vandana. That's a really useful take for students. So let me ask you, like, for students who feel they're very comfortable with their online preparation so far, right? They've completed online resource, maybe 5, 10 or 15 subjects online. For them, how do you think coming to an offline program will be beneficial? Like, what will be the additional benefit for such students who have already prepared well using an online resource during the UG by going for an offline program?
Regarding the preparation itself, I would say there are many updates. Our field is like ever changing, always updates are coming up. Even just before INICET, we got all the updates in FIGO classification. Two cancers staging got updated. So if you will have the table of the classification, of course, but then how do you study? But here it was made easy by the faculty. they broke down for us. In that class itself, I learned the classification, I learned the staging and the treatment. So it was, my input was very less for the learning those updates. And another thing is like, other than updates, by coming to a class like this, you get to see people, you get to see your own batchmates and other seniors who are preparing for the same thing. So that environment is very useful. Like you will be thinking like, okay, now I can sit back and relax, or like okay, I can take a day off, because everyone is studying, everyone is doing preparing for the same thing. So that will push you to study. And another thing is like, you get to meet, I would say, experts in all the fields, all the 19 subjects. You are getting to meet them in person. That is something different than you are seeing it in a tab or iPad. You are seeing them, but that's totally different. That experience is totally different. When I saw all the faculties here, so their experiences, they might not be talking to us through the app or something, or how not only about entrance preparation but also as a life as a medico, as a doctor. This is something like we get support from our seniors. Like after college, it is difficult to get into touch with our own seniors, but here, after coming here, I was like, I have, in every field I have somebody to look up to or somebody to ask something, and that is different, and that will motivate you for after exam also. The thing is that what should you pursue after you got a result, but the important question is what are you taking next. So to make that important decision, coming here was very helpful. So you see people who are successful in physiology, pharmacology, anatomy, like all the subjects from starting to first year to final year. So it's not that our medicine is restricted to only that few clinical subjects. So you know how other subjects are important. You get to see people who have become successful in other subjects also. So
great. Wow, that was really great. A lot of interesting points there. I'm getting a lot of questions to ask. So one thing which struck me when you said, because you told me before, even before INICET, you were at the verge of giving up because you didn't have much confidence whether you will be able to complete revision and give your best for INICET. And you told me it's because many of your friends, your hostel mates were there around you, nudging you, motivating you, right? And that made a difference, right? Vandana, like again, we have this system at TMCA which we designed so that it will be useful for all category of students, right? Wherein when they join, they are given a baseline assessment exam, which as you know is a mock exam with 200 MCQs to know where they stand. Then before each subject class happens, there is a pre-test for that particular subject, as you know. For example, let's take the example of biochemistry again. So before Rebecca ma'am's class, there is a pre-test which has like 40 to 50 questions from biochemistry, and pre-test gives a cross-section of that subject, meaning there will be at least 2 or 3 questions from each chapter in biochemistry. So that gives them a assessment before the class, right? And after the 3 days lecture by Rebecca ma'am covering complete biochemistry, students are given 3 to 4 days for self-learning, right, as you got. And after the 3-4 days of self-learning, we have the post-test, which will have around 100 questions or 200 questions from that subject. And you get to compare the pre-test score versus the post-test score. So we have seen you are one of the students who have come up in at least the top 10 in most tests, right, I believe. And we also seen students who have done like 20%, 30% in pre-test, improving amazingly well to around 80-83% in post-test, right? We have been witness to that. So what do you think is special about this system of assessment and self-learning and classes integrated in your opinion?
this is a good strategy to know to where to focus actually. So when you do the pre-test, you know where you stand in that particular subject, and then you get an idea about the topics that has been asked, which topics I should concentrate on, and while attending the class, you know which all the topics are our faculties is being stressing or repeatedly asked questions. And again after the class you get a note. Mostly in all the classes we get a note which we can stick on. So after you give enough time for yourself to learn it, revise it, and then when you do the questions, only then you will know whatever I have learned I am able to apply, and I am able to get the result. Like result is you being able to solve questions. No matter how many hours you spend learning, until and unless you are able to solve a question, that doesn't make sense. So at the end of your learning, if you are able to do well in post-test, that means whatever you have learned in those days are fruitful. Like so, this system is very useful.
Makes sense. Great. So let me ask you, like Vandana, you would have your favorite subjects, and similar to that, you would have your favorite teachers also. I remember you telling me, how Dr. Rajiv Dhawan sir's the motivational part, in addition to his awesome ENT classes, had a great impact, just before INICET. So who would your favorite faculty be? Because everyone has their own favorite faculty. I believe that is also decided by their favorite subjects to some extent, right?
Yes.
So who would be your favorite faculty be? 3-4 of them, and some instances where, like Rajiv Dhawan sir's, which really helped you become motivated.
Yeah, so this is tricky question. My favorite faculty is Rajiv Dhawan sir, of course, because he gave me a new direction and hope, like yeah, you can do it, and then all the tips which I used for INICET. So I would say, like credit, like I should give him a credit for this rank. So then Vandana ma'am took pathology, and she had a very organized class which is focused on INICET also. So and she was there with us till the last day, till the morning. Like I remember her sending messages at 2 or 3 a.m. On the day of exam. She always she keeps us updated about whatever updates are coming, whatever questions were asked in the SS exam also, which is likely to be repeated. So she was there with us throughout the journey. And Rakesh sir, he's my favorite teacher because medicine has been, he made medicine more conceptual and conceptual, and rather than learning or cramming up, I like to listen to his classes. Like I don't remember I don't usually take notes in his classes. I just listen to his class. Then after that, when I am learning or like rewinding those classes, I write notes for myself. So yeah, he would be these three were my favorite, and Ranjan sir and Mohit sir and Rebecca ma'am, and actually
I think you're going to name everyone, right?
Yeah. So yeah, the thing is, what I liked about Ranjan sir is, like in 6 days he helped me cover pharmacology, and it was very systematic, very updated. And I like my pharmacology notes more than anything. So you get to cover all the things in one page, like cell wall synthesis inhibitor in one paper, and anti-HIV drugs in one paper, antidiuretics with all the mnemonics in one paper. So you just have to look at, like, it's just like mind map. We made mind map in the class itself. Like you can just have to look at that, and then you know what you are reading. Making that subject pharm so easy, it's only I think he can do it.
Great. So I think all faculty at TMCA are your heroes, and you have named a few, right? Who are your favorites among your heroes? So I'll take this opportunity to thank them also for coming to TMCA and helping out our students with the academic part and with the inspirational part as well, right? So Vandana, you said you did your UG from JIPMER, right? I would like to know, how were you as a student in JIPMER? Were you a consistent topper during your MBBS days?
No, I wouldn't say that. I like to learn stuff. I was always present in the class. I was consistent in learning, but I was not consistently topper. I was not topper, like I don't have any gold medals. But I like the process of learning, going to class, going to clinics. That's something I used to enjoy. I enjoy a lot. So I give enough time or more than enough time in learning rather than going out or anything. I've explored very little of Pondicherry, being in Pondicherry for 6 years, but not a topper.
So you loved medicine as a whole, right? And you were very curious about learning, but you were not with the academic or the marks part. You were not on the top, right? During UG. Fine. So my next question, Vandana, is a very important question, and which I believe when I talk to a lot of students online or offline, stress is an important factor which affects everyone, not only students but relevant to our session. Let's talk about students. So did you have to address stress at any point in your preparation, and how did you overcome that?
Yes, I had to, but the thing is I expected, because I was prone for stress just before exams. It was 2 months before the exam. When I was trying to plan my studies for INICET, then I understood that there was a lot to be done and I have less time. This 3 revisions, from somewhere I got this intuition that I should do 3 revisions before exam. Yeah, that is true, you have to do 3 revisions, but when I wrote it down, I did not have the time. So at that time I started freaking out, and then I thought all this what if I don't clear this, what if everybody went and I am alone here. So all these thoughts came up. So how the point was like, I did not identify that I was stressed, and that's why I'm not able to perform well. I have a best friend whom I used to talk daily. I will talk some fixed time. So he was the one who pointed out that yeah, you are stressed, you are stressing out, you are not into the correct path. And then what we did together was we did analyze why was I stressed. So then I thought that the gap, what I want and what I have to cover and the time I have, that is what is stressing me out. And then what we did was what I want, what the rank I should get, which is the college I want to go. From that college we sorted out all the last ranks that has been taken for last 2-3 years, and then extrapolated my last GT rank to the 1 lakh thing, and he gave me a number like, okay, this much probability is there that you can crack, this much probability, yeah, you couldn't, but there is a gap, but you have 2 months time also. So he gave me like, yeah, he approached this thing in a practical way.
Sorry to interrupt, is your friend a statistician or a medical student?
He's an engineer.
He's an engineer?
Yeah.
Great. So he was your go-to person for a stress busting.
Yes.
Great. Yeah, please continue.
So then from there I started strategizing it. Like I understood what to be done in this 2 months, this much I have to cover. When I believed myself that okay, if I cover this much I can get this, then the stress part was coming down. And my family has been a very good stress support always. Then I talked to my mom and dad. Then they were like, yeah, you do whatever you can, you do the best, never worry about the results, you do whatever you do, you have been doing it since like 6 years, like whatever you have been doing, but don't always worry about result, just you have to do whatever you are supposed to do. And my sister is like, she doesn't care about when I say what if I don't pass, what if my friends get and I be alone, what if that happens, you are strong enough to cover all these things, and we are all here. So she was also great support. So I had a good support system here. And after that, when strategizing was the important thing, once I found out that this is supposed to be covered in this 2 months and I have a plan. When I had a plan, then I was okay, I am just following the plan till the end. When I have a bad day in between, and here I have many friends that are like, okay, if you are not feeling to read now because you are stressed, just come with me, I will teach you this topic. So that also, not even a single day was wasted in the last 2 months. And another thing is that I do Kriya, I do yoga. So it helped me to think more clearly, to strategize and to plan, to make a plan, go with the plan, that routine. So that also helped me a lot.
Great. So the best part about this interview is, many of the questions I want to ask, even without me asking, you're answering. So as an interviewer, my job is very easy now. So because I was about to ask, how do you exercise? Do you have a mentor? You all answered all that right away. Amazing. So, it's good to have a friend or a mentor, right? It can be a friend or your family or the people who are preparing alongside with you, right? And all of them helped in some way or the other, right? That's what I understand from your story. And one thing, again, you said in the beginning, doing that statistically, what you need, which seat you need, which college you prefer, what's the rank you need, what's the score you need to get based on the previous data, right? And I think that's one good thing we do right at TMCAA in the in the orientation session at the beginning, which Dr. Rakesh gives you, you know, the ranks and the marks and which specialty you can get. Great. So again, you know, you also mentioned about revision, because you had this notion of 3 times revision, which is mandatory to crack the exam. So I'll come to that revision straight away. How did you revise, right? And what would be the strategy for a student coming to TMCA in the future for a good revision?
First, I'll say how did I revise in a very less time, because my aim was to crack INICET and I had little less time than my friends. So in this, I had 2 months when I realized, and I had a plan. I started from the last day of the exam. Like, I knew what to do in the last day, and then I knew already what should I do in the last 10 days. So my aim for the rest of my time was to be able to revise all the 19 subjects, not all the 19 subjects, but whatever I need to revise in the last 10 days. So I had to cover few subjects on my own, so that I did it some 10 days. After that, I started my revision. So I had around 30 to 40 days for revision. Then I understood that, like, I had done maybe 1 or 2 revisions for many subjects, because I was studying during the class and then during the post test. So I shouldn't count like, no, today I am starting revision, from this day I should do 3 revision. No, it's not that. I have done many subjects. It differs from person to person. I have studied so many subjects like psychiatry, FMT, which has been taken initially many times. So I understood that, okay, I knew those subjects. So for those subjects I did only 6 hours, and for some subjects only 4 hours. Only 4 hours I covered all the things for dermat, FMT, psych. So those short subjects. So then when big subjects were there like OG and surgery, which I had to stress, I gave those subjects days, 1 day, 2 day, and I never gave 1 whole day to one subject. I always try to mix and study. And also integrated study is very important. So after finishing the TMCA classes, I had everything in my hand, every notes I had. So physio, pharm, path and micro plus medicine. So these 4 subjects I tried to learn together. When I study respiratory physio, in physiology, respiratory physiology is very important. So I study that, and whatever points extra I had to add from medicine, I did add. And after that, some core medical topics like ARDS, bronchiectasis, whatever, that I learned from medicine. That was very short notes was there. Then in pharm, so RS, asthma management in pharmacology. So it's more like integrated. And when I study neuro also, same thing, neurophysiology, neuroanatomy, neuromedicine, and then pharmacology. I will study about anticoagulants and whatever is relevant to that.
The interesting thing is, I think, you know, you have a lot to say. The only problem is we have limited time.
Yeah.
I really wish we could roll out, you know, a part 2, part 3, because I'm sure you have a lot of tips for each of the 19 subjects, right? Because each subject has to be obviously treated differently. But just to get into a little depth, before we go to the, you know, one of the best parts of this session is the rapid fire round, which, you know, I'll get into. You know, I remember you telling something interesting about dermatology, which Malcolm Pinto sir also, you know, gave you enough confidence that you could even skip the question bank.
Yeah.
Can you just say, you know, a strategy for a short subject with dermat as an example?
So first is dermatology. Dermatology, we had a workbook which is very concise, which covers everything. So you just had to do the workbook. It will take, if you have revised it once before, it will take hardly 3 hours to read word by word. It is important that you read word by word, because that is that much high yield and each word is important. So, and then you have to solve PYQs. PYQs is a must for every subject. So you do PYQs. You can skip chapter wise question, because you see the questions asked, number of questions asked is like 4, 6, not more than that. So you will be able to, you will 99.99% you will be able to solve those questions if you do this. So you can cover up that subject in 4 hours to 5 hours.
Great. So may I ask you, because you said 99.9% and all, if you look at the entire program at TMCA for students who just depend on the TMCA program, including the pre-test, post-test, plus the classes, plus the workbook, plus the tips which the teachers share in the group, like you said, Vandana ma'am shared a tip even before the INICET exam day. What would be the strike rate for an exam like INICET?
I would like to say, when I mean by strike right is not that exact question is being asked. It's not only about that, it's about how are you able to address a new question and come to answer. So if that is I would say more than 80%, because we discuss questions in class. So not about all the previous Qs already asked question you can answer. Other than that, that is 100% you can answer, because all the PYQs has been discussed in one way or the other in the class or in the test. So that you can answer. But if it's sure that some new questions should come. So out of the box and new questions comes and tricky questions can come. So to answer that, you will be able to answer that if you have attended the classes and then gone through this process.
Great.
More than 80% I would say.
So again, winding up about the subjects, which subject should you prioritize in the given time, right, of the 19 subjects? If you think it's different for INICET and NEET PG, you can be specific.
I would say I would take some time. I would start by saying the questions in each subject. So in Anat and Physio, in the years, range has been 8 to 18 questions. When you see the trend, as you come
8 to 18 questions from Anat plus Physio?
No, Anat and Physio separately.
Okay.
Like in 1 year, it has been 18 questions has been asked from Anat itself. But when you see the trend,
this is for INICET?
It's for NEET.
Okay.
NEET and INICET also it follows almost the same pattern.
Fine.
But if you see the trend, it is like this Anat and Physio questions has come down to from 18 to some 10, 18, 8. But that's because the questions has become more integrated. You cannot say it's purely anatomical. It can be from surgery, it can be from ortho. So, but first year compared to NEET, what I would say there's what difference is that first year, second year subjects have more importance in INICET. Not from the number of the questions that are asked, but if you answer that question correct, it will take you more forward in the rank list. That's how. Number of questions is Anat and Physio like this, but biochemistry is consistently more than 10 questions are asked. When coming to second year subject, Pharm, Path, Micro, more than 20 questions are asked. And then in final year subjects, surgery and OG 25. Then medicine, you don't know which all questions to put in medicine and separate it from Pharm, Path, but more than 20. Or sometimes even in INICET recently there has been 30, 40, 50 questions from medicine.
It's one of the most important subjects.
Most important subject.
And it's also clinically integrated.
Clinically integrated. So when prioritizing, I would stick with the integrated pattern. I kept my priority first as combinedly learning Physio, Pharm, Path and medicine. And again you have to learn micro also. So these subjects if you learn together, it will carry its weightage is very much, like if you can say more than some 25% weight, 25% to 50% weightage will be there for these subjects combined.
Yeah. And those are the deciding questions.
Deciding questions,
the other questions may be answerable by many students.
Yeah.
These questions, if you really go into depth of those subjects, you will be able to crack.
Yeah.
And accelerate, improve your
rank. It's a base. It's a edge questions. It gives you an edge. It forms the base to understand many other questions also. So all the subjects together, if you are a strong hold, then yeah, you have done majority of your part.
Great.
Then another two subjects are surgery and OG. These subjects are independent subjects, I would say, and they have patterns of questions are like stock questions. Like surgery, there are many questions that you cannot go wrong. If you know it, you answer it. If you don't know it, you cannot answer. And if you invest your time, like some little amount of time to building concept and getting the right answer in a good way in both the subjects, it will stay with you for long, rather than volatile subjects like biochem or FMT. You will forget easily. But if you form a base in surgery and OG, and there are typical questions are asked, so if you focus on those questions and if you are focusing on questions, then it will be in your memory for a long time.
Okay. So just a follow-up question to that, by meaning preparing for focusing on questions, you mean after you learn the theory, you immediately go to the questions and solve them, right? Is that what you mean?
Yeah, not only solving the questions, you solve the questions, but then after solving the questions, you know what type of questions are asked. For example, like in surgery, it's always what's the next best step or what is the investigation of choice. So whatever topic you are learning, you should ask yourself, what is the investigation of choice in this condition, or what is the next best step. That both questions are different. So our aim is to pick up the best answer in that 4 options. So you have to, like, while doing the questions, you always have to think like that, in that angle. If you start thinking in that angle, that concept or that part will stay in your mind for long. And so that also means that you can keep surgery and OG little away from, even if you keep little away from your exam date, that's also fine, because it stays in your memory for long. And keep the volatile subject more near to your exam date.
Great. I think, a lot of information I would love to learn from you, and in the interest of students, we should definitely do a subject-wise short video, how to approach each subject. I think we'll try to do that if time permits. So, like we said, let's go into the interesting part of this session, which is the rapid fire round. So, like we know, it's exactly like 10 days from the INICET now. I understand that you might have forgotten a lot of the volatile topics or subjects you have learned.
Yes.
But this is just in interest of students. So what rapid fire round is, Vandana, like, I'll share few questions, most of them from the recent INICET, which you have attempted 10 days back. And the attempt here is not to see if you can answer it or not. The attempt here is to see how you approach that question, right? And I would request you to think out loud and read out the question, so that our students can see how the topper's mind works. What I'm trying to say is, there may be some questions you know clearly this is the answer, right? But there may be questions you rule out the options and then arrive at the possible answer, right? So I am sure that will give a huge confidence and huge clarity for students, many students, how to approach the question after learning, after revising, and finally when they appear for the exam, right? Are you game for this?
I think I regret not seeing recall videos, but yeah, I think we will go.
Great. So no problem. So we'll be liberal to you. You can make mistakes, no problem, right? And I think this INICET, there were some pretty confusing or tough questions. And again, these are recall-based questions, so it may not be completely complete, right? You understand that. So I'll send you the questions one by one on your phone on WhatsApp. Let's start off with the first question. I've sent the question to you, Vandana. Can you please check if you have received it? It's a question from psychiatry, right? Do you want me to read it to you, or you want to read it aloud? And okay, please.
A patient was started on amitriptyline and was found unconscious. Which of the following doesn't suggest TCA toxicity? So doesn't. Arrhythmia, confusion, hypothermia, pupillary dilatation. It's hypothermia. C.
Okay. So how did you arrive at the answer? You know it already from
I knew it already.
Recall, or?
I knew it already from class. Like,
okay.
Yeah, this
Fine.
TCA toxicity.
Okay, great. Can we go to the second question? I think it's from surgery. One of the tough questions I heard, right? Okay.
Which of the classification of bile duct injury takes into account location as well as thermal injury? Strasbourg, Bismuth, Stewart way. This question was sad. Stewart way, because I would like to, this INICET it was asked, and I was sad that in the morning I had done both the Strasbourg and Bismuth classification, A, B, C, D, E, 1, 2, 3, 4, 5, everything. But then they asked which is other than that. I was sad initially, but then I read the options. So two of them not, I was sure that it was not that. And the fourth one, I remember reading it somewhere else. I don't remember exactly the option, but I remember reading not in this chapter, somewhere else. So initially I was sad. I thought, oh God. But then I thought, okay, I could rule out and come to the answer. I think it's the C, Stewart way.
Stewart way.
Yeah. I don't know the classification. I actually didn't read up also after that.
No
but
this is like one question you think you haven't seen at all, right?
Yeah, I haven't seen at all. In the sense, I didn't think that it was possible to ask something else.
Yeah.
Other than these two classification. I thought they will ask deep into the classification, number and all, like they will ask what is C, Strasbourg C. So I knew that, but I did not think that they would ask another classification.
Got it. So let's move on to the next question. I think it's from obstetrics.
Yeah, obstetrics.
A long one, please go.
Yeah, a pregnant woman at 30 weeks, painful bleeding PV, with reduced fetal movement. On examination, uterus had increased tone. Okay, uterus increased tone. 34 week size, FHR is absent. So BP is 166/98 per PV, cervix 6 cm, 70% effaced, vertex -3. Intact membranes. Okay, intact membranes. So I would say
we can also read out the options.
Options, we have only 3 options. Emergency LSES is the first option. Second option is start antihypertensives and emergency LSES. Third option is start antihypertensives and ARM. So I would say it is not A. I think it's C.
Okay.
I think it's
How
C.
did you arrive at that answer?
Because first thing is the diagnosis in the case is abruption, most probably. Tense uterus and hypertension is a risk factor. So that's BP is 166/98. We have to control BP. So only emergency LSES cannot be the answer. So A cannot be the answer. Other thing is like B or C. I'm confused between B or C. Then you have to start antihypertensive, and because they have given intact membranes, I would go for ARM, because LSES is abruption itself is not an absolute indication for emergency LSES. So I would go for C. That's right.
Got it. That would be the next best option compared to between B and C. So you go for C. Great. So let's go on to the next question quickly. It's from pediatrics. Anesthesia. Okay. Sorry. Yeah. Please go ahead.
In a child given oxygen by nasal cannula at 3 liters per minute, what is FiO2? Actually, I haven't done anesthesia at all.
And the options are very, very close, right? 30%, 35%, 40%, 45%.
No, for sure.
Okay.
If I seeing this FiO2 itself, I would have I skipped.
Oh, you skipped that question because you told me you didn't get time for
anesthesia. I didn't do anesthesia at all.
Okay, fine. So that is one question you skipped off the 200, right? Let's go on to the next question quickly. Again, question from medicine, right?
There's an ECG picture.
Yeah, we'll show it in the video also. You can.
Yeah, ECG picture is there, in which there is PR interval is constant, but there's a QRS is missing. There's a drop.
Yeah.
That is
for the interest of the students, can you please read out the options also? There is ECG.
Options.
Plus there are 4 options.
Options are like first degree heart block, B is second degree heart block, C is third degree, D is AV dissociation. So even if you don't know anything, no, C and D are looking same, no. Third degree heart block and a complete atrioventricular dissociation. So you are stuck, even if you don't know blocks, it's just A and B, but heart blocks are like hot topic, so everybody will know the ECG. So this is a picture of second degree.
Okay, so the answer would be second degree, it's option B, right? Great. So next is a question from anatomy.
So anatomy, there's an image of our ear ossicles. So it was asked in last INICET, and the joint between malleus and incus has been marked and asked what is the joint, type of joint. So it is saddle joint. It's a previous year, straightforward previous year question.
Okay, great. So next question, again pathology, right, on hepatocytes. Okay, please go ahead.
Which of the following disease is associated with storage of non-functional protein in hepatocytes? Options are alpha-1 antitrypsin deficiency, Tay-Sachs, familial hypercholesterolemia, Wilson's. Answer is A, and it's very easy. Not easy, I would say. They've asked as a non-functional protein. So if you know proteins, then you know the answer. It's only alpha-1 antitrypsin is the only protein in the option. Tay-Sachs is not protein. Familial hypercholesterolemia is cholesterol. Wilson's is copper. So it's A. Even if you don't know, it is A.
Okay, great. So I think we are coming to the last question in the rapid fire round. And yeah, please go ahead.
It's a most preferred anticoagulant in grave acute retainer. Options are EDTA, potassium EDTA, sodium fluoride, potassium oxalate, and heparin. So answer is actually potassium oxalate. This question came and I was happy because this could be a trick, because they asked anticoagulant, not additive. There's a chance that there were people who marked sodium fluoride. That's an additive. It's not an anticoagulant. So anticoagulant in gray is potassium oxalate. So it's like you just have to be careful. If you will know the answer, but when you, and especially in this new pattern, you have 45 minutes, 50 questions, you tend to jump into answers. But yeah, you just have to read the question, each word, before coming to answer.
Great. So here it is
Answer is C.
potassium oxide. Great. So I think of the 8 questions in the rapid fire, you got 7 right and you skipped 1,
Yeah.
right? So that's great. That's great. So was it kind of similar in the INICET exam also? Did you skip more questions, you remember?
I skipped 10.
10 out of 200, right?
Yes.
And because you reminded me of the new pattern of these blocks of questions, 50 questions in 45 minutes into 4 times. How did you have any strategy for that?
Actually, I was happy that when this pattern changed, because otherwise you will have to, you will do all the questions at a stretch, means you will finish all the questions and then you will start reviewing from the first. But here they are split it into 4 parts. So you complete that part. It's just like attending a mini test, or I would say subject test or post test here. So you finish that 50 questions and you have to review all the questions within that stipulated time. So it makes sure that you are not utilizing more time to one question. For me, first session was easy, and so I had more than 5 minutes left. But third session was like I was like in the edge, like I finished just in time. So it can be that variation is still possible, but still like this is. But the only thing is that you shouldn't panic. You shouldn't panic that okay, I just have 45 minutes. If you panic and if you start running through the questions, there's more chance that you get negative marks, because even you just have to understand that it's the same. You get the same time for same number of questions. So if you have done enough GTs before, if you practice, even change of pattern does not change much. So it actually makes it more easier. Yeah.
So that's amazing. See, I think the way I also look at it is very similar. I try to look at it as like a video game, right? Where you're guaranteed to go to the next level. And once you go from level 1 to level 2, you have to just forget about level 1 and fully play the level 2, right? So without panic, like you said, right? Great. So it's also a test of how calm you are, how composed you are through all the levels.
Yeah, till the last minute, you have to be. You have to have all your like common sense, whatever thing that you have, all 4 lobes of your brain working for only solving the questions. Till the last minute, yeah, you have to just be that calm.
Great. So thank you, Vandana. Thank you, all our viewers. So I think we had a very, very fruitful session, very free-flowing session. I was just enjoying it. Hope you enjoyed it, and our students will also love this and have a lot of practical takeaways, very honest takeaways from a student who has come this long, right, from being a mediocre student in UG days to a topper, right, for INICET. So I think we'll wind up the session with that. Thank you once more, Vandana, for all your valuable tips. And at TMCAA, the entire team, the entire faculty, the coordinators, the staff, and your classmates, your friends, everyone is happy, really, really happy, and proud, right, that you are one of the students who could benefit from the TMCAA program, right? So with that, we'll wind up the session. Thank you and wish you all the best for your future life and your career. Great.